So in COVID times, we had to make adjustments based on the Center for Disease Control guidelines. We currently are using screening policies, screening procedures for everybody that comes to the center. And the very first thing that I would say is you shouldn't go to your doctor's office, you shouldn't come to the center without prior communication with us to have you on an appointment. We discourage walk-ins because we're trying to decrease the risk of transmission of the virus. So as you come to the center for a scheduled appointment, we're going to ask that you come wearing a mask. And at the entry, there is a screening process. They'll take your temperature and ask some questions to make sure that we are doing our best to decrease the risk of spreading the virus for individuals that come to the center. We also ask that you, ideally, the person who has the visit only come to the visit. For children, obviously, one guardian is the ideal to have them accompany the child. We've decreased the number of patients that we take care of in a given time frame because of the social distancing guideline. So our waiting room now has half the number of seats available, so that when individuals are in the center, we're working hard to maintain that social distancing. We had decreased the number, the types of visits, but currently we're, for medical, able to see all the visits, whether it's a chronic disease visit, whether it's a well child visit, whether it's an immunization visit, because we did see during the stay home, stay safe order that we wanted, that individuals that wanted to come in were not able to come in. And so we're a little behind on visits, we're a little behind on immunizations, but it is very, very important that we bring everybody back up to date with their chronic disease as well as their vaccination schedules, including now in this season that we're starting the flu vaccine. It's going to be even more important this season to get the flu vaccine because of the COVID pandemic that we're in, the fact that the symptoms are very similar, the fact that the way that we decrease the risk of spread for both are very similar. We want to be able to eliminate flu as the reason for the symptoms that individuals are presenting with. So it's very important that you get your flu vaccine this year. I know there's a lot of challenges because of beliefs and other cultural norms, but it is extremely important. It's a very safe vaccine, been around for a long time, and will help us decrease the risk of flu as we work through the COVID pandemic. The vaccine for COVID is still a ways away. I know that there's talk about it coming soon, but to have a vaccine that's going to be safe for everybody, it's going to take a little bit more time to make sure that the vaccine is safe from a side effect standpoint, not just from the standpoint of being able to take care of the virus. We have transitioned some of our visits to virtual visits. Obviously, that doesn't work for immunizations, but we've been able to, for some of our chronic disease patients, been able to communicate with them virtually to make sure that they have the medications and the referrals, and we can order labs for them to free up space to be able to bring in the well child visit patients and the ability to bring their immunizations up to date. So we're going to be doing vaccination campaigns for flu, where there's an initiative through the state as well as through the city that we're participating in to really, really ramp up not just the vaccinations that are required for school, but also the flu vaccine to help decrease the risks of when someone has symptoms, knowing that they have the flu versus COVID.
Some folks I think, are concerned about what else is in vaccines that might be harmful. Can you speak to that at all?
So, vaccines that have been created, produced, and disseminated, or that are being used, are very, very, very safe. As these vaccines are being developed, the manufacturers and the regulatory bodies are always looking for what are the side effects that can happen from getting that vaccine. Same thing with any medication, new medications that come out. And there's always going to be even if one person in those trials has a headache, they have to put that down as a possible side effect. Even if it's only one individual out of thousands that get tested with the trial vaccine or the trial medication. So there's always a fear of, are the side effects going to outweigh the benefit of the vaccine? And I can tell you that for obviously all the ones that the schools require, as well as some of the other ones that they don't require, the one that protects against cervical cancer, the flu vaccine, are very, very safe. And the benefit that we're going to get from using those vaccines significantly outweigh all of the possible minor side effects that you can get. So all of the talk about autism and the talk about many other things that are major to us that can happen from a vaccine are almost non-existent. And the benefit that we're going to get from protecting everybody from the flu, from all of these illnesses that used to ravage the world in the past are much more significant than any of the possible side effects that we could get from them.
Where can people with no primary doctor get vaccines?
So the health department has sites where you can get vaccines if you don't have a primary care provider. I do not want to promote not having a primary care provider, because vaccines are not the only thing that we need to do to prevent illness. So the health department does have centers, sites that you can get vaccines if you don't have a primary care provider. We do provide vaccines for individuals that don't have another way to get them here at the center, but we are pushing and recommending that you become an established patient of the center to do that, because it's much more than just receiving a vaccine to protect against these things. It's all of the other visit things that are included.
Great. Last question. Kids are afraid to go to the doctors right now. How can we alleviate their fears? How do we approach this?
Okay, so everybody has been receiving for some time some mixed messages. At one point it was stay home, stay safe, don't come out for anything unless you need to get food. Now, I think because we don't have a vaccine, because we don't have an effective treatment yet, if we are wearing a mask at all times when you leave home and you're using social distancing and washing your hands frequently, the risk of transmission of the virus is extremely low. So I think for right now, for individuals that are afraid to leave their home, even to go to the doctor, if you go and you wear your mask the whole time and you're using the social distancing guidelines and you're there exactly for what you need, and then you go back home, the risk of transmission of the virus is extremely low. So it's safe, and I know it's a scary time, but we know how effective the mask is in protecting individuals that don't have it and in preventing the spread for individuals that do have it.
Thank you so much for being with us today, and thank you so much for all of your helpful information and for all the work that you do every day in Southwest Detroit. I just have to give a little shout out. So thank you so much.
You can find more at onedetroitpbs.org or subscribe to our social media channels and sign up for our One Detroit newsletter.